Welcome to the four-part video series about diabetes and improving resident outcomes in long-term care, presented by Superior Health Quality Alliance. This recording was developed for healthcare workers with an interest in providing care to individuals with diabetes residing in long-term care settings. The first video will address strategies to improve diabetes management. You may watch each video in order or based upon your interest. The objectives for this learning session is to achieve the following. Identify barriers and strategies in treating patients with diabetes in long-term care. Our goal is after the video, you will have a better understanding of this topic and how it applies to your own healthcare setting. Let's discuss the barriers to caring for patients with diabetes in long-term care settings. Even the best treatment plans can prevent the progression of the disease, which often leads to additional complications and increased risks to multiple body systems, adding complexity to treatment. There are four major geriatric syndromes, often referred to as the giants of geriatrics, which include immobility, instability, incontinence, and intellectual impairments. These syndromes can result in falls, fractures, dementia, depression, cancer, malnutrition, and as mentioned, incontinence, further complicating care. Additionally, various processes within the care setting can create unique barriers. At the end of life, the goals for diabetes management should focus on promoting comfort and controlling distressing symptoms, including pain. Patients may express a desire to stop taking insulin or other medications, and it's crucial to respect their right to refuse treatment. This can be challenging for caregivers whose instinct it is to treat, and the overall stress of maintaining patient health care can add to that difficulty. Now let's discuss strategies to improve diabetes management. Things have changed. Previously, it was all about carb counting, which may still be true for younger adults. However, for older adults, liberal or less restrictive diet plans have been associated with improvements in both food and beverage intake. This helps avoid dehydration and unintentional weight loss, as maintaining weight is crucial at this age. Avoiding restrictive therapeutic diets can be beneficial. It's advisable to steer clear of historically prescribed diabetic diets for older adults in long-term care settings. Growing evidence suggests that these diets may inadvertently lead to decreased food intake and weight loss, which is counterproductive. In response, nursing homes have shifted away from these diets, offering a wider variety of food choices to address personal preferences and provide diverse dining options. While carb counting should still be considered, it shouldn't mean eliminating concentrated sugars or sweets entirely. The risk of hypoglycemia is a critical factor in determining each patient's glycemic goals due to its potentially catastrophic consequences. For older adults, establishing individualized goals of care and management strategies is essential in long-term care settings. This requires acknowledging each person's complexity in terms of disease stage, complications, comorbidities, self-care ability, and life expectancy, as well as the risk of adverse drug events. Lastly, glycemic control shouldn't be limited to insulin alone. Treatment should be kept simple and safe, avoiding overly complicated regimens. Key takeaways and resources. In summary, here are some key takeaways from today's presentation. We want to focus on promoting comfort and controlling any symptoms of disease, including pain. We want to avoid those very restrictive diabetic diets. We want to risk hypoglycemia because it can have catastrophic consequences on the elderly population. Glycemic control shouldn't be limited to just insulin. We just need to be careful and avoid those complicated medication regimens. We have created a list of tools and resources that may be helpful to you to further explore what we've been talking about in these video series. We have provided the following resources related to diabetes in long-term care settings. However, care transitions can be used for any individual, not just those with diabetes. We would challenge you to ask questions about diabetes care management in your healthcare setting. Where are the gaps? Where are you seeing gaps in your processes? Are your residents experiencing hyper or hypoglycemic events? And what steps are you taking to prevent further events? All of these questions can lead you to the development of a root cause analysis, action planning, and initiating a plan, do, study, act cycle. We challenge you to analyze your data and determine where there are opportunities for improvement. Here are additional evidence-based journal articles that have information and resources included in them. If you have questions about this video series or others, please contact us at info@superiorhealthqa.org. Thank you.